People with dementia also experience a change in the use of sensory information that we all have. They have, firstly, a progressive decrease in their sensory abilities, just the ability to use their senses. So, for example, with sight, people have decreased depth perception, decreased acuity, so they may still be able to read, but they need large print. They have a decrease in peripheral vision, so they have what we call tunnel vision often, and they don't see side to side so well, and they don't see up and down. Color vision can change as well, and of course, with the slowness comes a slowness in processing what they're seeing, processing their visual input. The sense of smell is often decreased in early Alzheimer's disease, and this leads to an inability to taste food. So on our tongues, we can taste sweet, sour, salt, and bitter. All the other flavors that we're tasting, we're actually smelling. And so one thing that happens with many people with dementia is that they prefer sweet foods or salty foods because they can still taste them, and other things they just can't taste. I remember one fellow in a group, he used to keep adding sugar to his tea, and he said, you know it's hot, but I can't taste the tea, and I can taste the sweetness. And so with touch, there's often a slowness in processing in terms of what they're touching. Many people complained that they actually had numbness on their fingertips. And I've talked about proprioception, of knowing where the position of your body parts. So another form of change in the experience in terms of using sensory information is connecting what you're sensing to the matching meaning. So for example, somebody has a stomach ache. Well, maybe in the past they might have recognized that they were hungry, but now they don't know they just know they have pain, and they're not sure what to do about that pain. I remember one lady who rushed her mother to hospital. Her mom lived with her, and she was looking after her very well. And she was so embarrassed because her mother was dehydrated. Her mother was feeling thirsty, but forgot what that meant, what that feeling meant, and what to do about it. And so she just stopped drinking. And so her daughter instituted a new procedure. She put a pitcher of water into the fridge, and every day that pitcher of water, her mother had to drink it, and her mom got used to that new procedure, and that's how they avoided dehydration. Sometimes people, I think I talked a little bit about how connecting information like what things are, what cutlery is, how to use it. They may also not recognize food. So you put food down in front of them and they have no idea what it is they're supposed to do with that. And this is not recognizing cutlery, not recognizing food, forgetting the procedure of feeding themselves. Of course, this is one of the reasons that people eventually need to be fed. One lady who was living alone became very agitated, and she told her son when he came over, you know, there are animals in my walls. And he listened and he said, Mom, I don't hear any animals. And so he was going to be there for a fair length of time. And then he noticed that whenever she heard the animals was when the furnace was kicking on. So she could hear the furnace kick on, but the meaning of what that sound meant was gone for her. And then she was trying to figure out what it was and getting alarmed about it. And so it can be, a lot of these things, of course, are very frightening to people. Another aspect of the experience of having sensory changes is that we're completely dependent on our brains to accurately tell us what it is we're experiencing in the outside world. For example, one lady with very early dementia related how when she was going downstairs, because she used the stairs quite a bit in her apartment building, she'd be going downstairs. She says, I can see I'm going downstairs. I know I'm going downstairs, but my body's telling me I'm going up. And when I go up, my body's telling me I'm going down. So you can see how disorienting. I mean, she knew what was going on. Imagine if it was somebody who didn't know, and how perturbing that would be for anyone experiencing that. Another lady was out in the front yard, and her daughter saw her, and she was talking to a little green tree, something like this, had just been planted. And she thought, what on earth is Mom doing talking to this tree? And she went over, and her mom said, this lady in this lovely green dress, she wants to meet you. So you see, what her daughter saw was what was there. It was a little green tree. What the lady was seeing was a woman in a green dress. And so, as I said, we're completely dependent on our brains to give us the right information. And with dementia, sometimes, of course, that's disturbed. Another fellow described how this is really an example of the slowness of processing visual information, and how people experience what they're sensing. He saw somebody, and he was talking to somebody who was standing on that side of the room, and then he swung his head around to look at the other side of the room, and that image tracked across the room. So he understood that the fellow wasn't actually moving across the room. For one thing, he didn't walk. He just stayed and went across as he changed his gaze. But again, imagine how that's going to be, how confusing that will be for someone who wasn't like himself and wasn't able to say, well, you know, we used to use the term, my mind's playing tricks on me, to help them accommodate to those changes. Also with hearing, there was, I remember one fellow, I was visiting with his wife and himself in their home, and she was very impatient with his short-term memory loss, and so he asked me to explain short-term memory loss to her. Now, normally when I'm talking to someone with a dementia, I talk very slowly like this because it takes them a long time, and I'm watching their face to see, are they processing that? But when I spoke to her, I made a mistake and I sped up, you know, because I was talking to someone with normal processing, so I did that by mistake. And at the end, he said to me, you know, I could see your lips move all the way through. In the middle, you were making sound, but at the beginning, you were making sound. In the middle, there wasn't any sound coming out of your lips, and at the end, I could hear you again. So what was happening is his visual processing was working in straight time, but his auditory processing was slow. So when I was in the middle, he was still processing what I said at the beginning. And when I stopped at the end, he could then finish processing it. But he didn't hear the whole middle of it. So, you know, that's a good illustration of why it's so important when people seem to not clue into what you're saying, even though they do clue in sometimes to other people. Maybe it's slowing down that you need to do. So, you know, I think it's very important not to dismiss any difficulties that people have with agitation, with just saying, oh, well, you know, she has dementia. That's what her problem is. Because there are many, many thoughtful things that you can do to decrease the stress that people have from not knowing what's happening or not being able to understand. For example, putting up a sign. There was one family, this couple was in their 90s, and all of a sudden he started wandering. And he had a walker, and he was legally blind. And so when we talked about the situation, what was happening was every time his wife went to have a nap, he went down the street, and he was looking for her. With his Alzheimer's, he could not remember that she had a nap every afternoon. And so what we did, because he was legally blind, I think the letters on the sign were yay high, but she had a sign that she could put up right by the door where he would see it just before he left to go down the street and look for her with his walker. And it said, I am sleeping. So he probably went to that sign, you know, every 5 or 10 minutes, the whole time she was taking a nap. But he didn't go down the street anymore. And of course, this raises all kinds of red flags. Oh, well, you know, he's a wanderer. We better put him into a nursing home or whatever. You know, there's something else needs to take place here. But they were in their home for another couple of years together, and probably that was very helpful. So, like I say, it's important not to just stop with, oh, you know, she has dementia, or oh, he has dementia. It's often very individual. I remember visiting someone in a nursing home, and the staff were frustrated because she could read. This lady with dementia, she knew what she was reading, but she always lost her room, and they had her sign on the door, you know. Well, they had obviously talked to her about it when she was sitting down, because they asked me if I could see what I could do. And I followed her down the hall, and she was like this. So the sign was up at our eye level, and the sign needed to be in the bottom foot of the door. So it's really important to follow through and to have faith in yourself that you're going to be able to figure something out for these people. You know, and so then when she wandered by, all of a sudden there would be Sophie's room. Oh, there's my room, you know. So it can be very, very helpful when people truly try. People with dementia also experience alterations in judgments, in making judgments. It's very difficult to make decisions and to make judgments. So in order to make sound judgments, we need our memory. We need all processes of our memory. We need accurate perception, being able to understand what's going on in the environment and be able to interpret it properly. And we need to understand the situation. And we need to hold all the pertinent factors about what is needed what information is needed in order to make a sound decision. And we hold all those factors in our short-term memory at the same time. And so when the short-term memory loss also has an effect on not being able to make judgments. And so one example of someone who didn't exercise good judgment in her dementia, she was living with her husband in an apartment, and she no longer recognized him all the time. And she was always, whenever she would get upset, she wanted to go home to her parents. And this is a very familiar situation for those of you who deal with people with Alzheimer's. And she wanted to go home to her parents on the farm, and he argued with her. Her parents were deceased. The farm had been sold. She couldn't go there. She felt that her husband was keeping her prisoner. That was the situation in her terms. That was her experience and her understanding. She also had lost track of what type of behavior is acceptable when you're dealing with another adult. And so the inevitable happened. He grabbed her when she was on her way out of the apartment late one night, and they ended up actually having a fist fight, rolling around on the floor and punching each other, because it just escalated right out of control. Fortunately, their daughter came over, called the police. She was taken to hospital, calmed down over a few days. And the police said, you know, go in and find out about Alzheimer's disease. And so he did. And after that, when he understood the memory processes and why she was doing what she was doing, she would say, I want to go home and see Mom and Dad. And he'd say, sure, let's go. And they'd get on their coats and they'd go in the car, and then he'd say, let's stop at Dairy Queen or Tim Hortons and we'll have a cup of coffee. And he would distract her into something else, and pretty soon then he would just drive home and she was fine. And so, of course, distraction is a very useful thing to use with people with dementia to help them stay calm. And it works because they can really only keep one thing in their mind at a time. Now, you know, it depends on where they are, how gently you introduce this. But it's a very important thing to keep in mind. I don't feel that it's manipulative. I feel that it's giving peace and a feeling of security to people with dementia when you use that. It has to be used in an honest way, but it's a very important tool because this disease creates a lot of anxiety. And I think, too, that people often are asking for their parents when they're feeling insecure. And so not to worry about trying to tell them that their parents are deceased, which, of course, they're never going to agree with you, so there's no point in doing that anyway. It just causes them upset. But to understand, okay, this person is feeling insecure. What can I do to make them feel secure again? One example of lack of judgment that's very commonly experienced, especially in the early stage of dementia, is trying to go to a restaurant. And I don't know if any of you have gone to a restaurant with people who have short-term memory loss, but you know, you look at the menu, might be 6 or 8 pages of menu that you have to pick something out of. So you have to have an idea of what category you want. And then there's still 10 items. And you know, there's 10 different kinds of salads, 14 different kinds of sandwiches. And you have to keep all of those in your mind at the same time as you sort through. And so I kept hearing about this difficulty from families, and the person with dementia would just kind of look at the menu like it had no meaning and say, well, what are you having? You know, and they'd say, well, I'm having ham and cheese. Well, I don't like ham and cheese, you know. And then the family, then there'd be an argument. Well, you don't have to have what I'm having, have whatever you want, you know. And so this kind of banter going back and forth. Of course, the person with dementia is getting more and more stressed. They have no way of figuring out what they're going to have, and they need help with that. And they know that they're making their family member annoyed, and they don't like that. So decision making is very difficult. One lady mentioned to me that her husband could dress himself, but he couldn't pick out his clothes at this point in time. So she would put everything out, and he took half an hour longer to come downstairs. So she wandered upstairs to see what was going on, and by mistake, she'd left out a brown belt and a black belt. And for 30 minutes, he was going back and forth, brown belt, black belt. You know, couldn't decide what to wear. And now, the decisions, the wrong judgments that people make are not always as innocuous as not being able to pick out the right belt. People often get very angry at the decisions that a person with dementia makes. And you know, with caregivers, it's not reasonable to expect that they're never going to get angry and they're never going to get impatient. It's just very important that they learn how to get past that as quickly as possible. Especially if there's a large negative impact on their life, and they need other people to talk to, and they need people to help them work through what to do. The more the caregiver knows about dementia, the more they can accept that that's what they're dealing with from the start, and the more steps they're able to take to protect themselves against what's going on. So, for example, there was one lady that I knew whose husband ended up putting over $30,000 on their credit card. Now, she didn't want to curtail his freedom. You know, she really didn't want to take that step of taking away his credit cards, because it was very difficult to negotiate with him that this would happen. You know, it's possible to maybe switch to a single card, or having a card with a prepaid limit and that kind of thing. And then also trying to anticipate what is going to send him into a spending spree. And with this fellow, he had vascular dementia. His spending was triggered. He needed to feel powerful sometimes. He needed to feel competent sometimes. And also, you know, he needed to get back at his wife every once in a while if they had an argument. So this is when he would go out and spend. And eventually, you know, that bill went far beyond what they could manage, and she just had to bite the bullet and take the credit cards away, because her own financial security was under threat. But that was very difficult, because of course he was very upset, and then she had to explain it to him over and over again. And this is when the carers really need a lot of help and a lot of support. You know, at this point in time, the person with dementia looks normal, and everybody thinks, oh, well, they're doing okay. Nothing too much is going on. This fellow was still fairly early in his dementia. But know that that caregiver is really going through huge difficulties. And it's actually, I think, more difficult in the early stages, because people with dementia look so normal and appear so competent, and nobody believes that they have dementia, and the caregiver is going through all of these issues at the same time, and so they really need a lot of support. People with dementia can make enormous mistakes in judgment. And I'm thinking here the case of a grandfather who came on sexually to his granddaughters. Now think about the long-term memory loss. He didn't remember that he was the grandfather. He didn't remember how old he was, and he didn't remember what the role that was appropriate in the family. And so what happened was all of their children completely abandoned this couple and didn't want to have anything to do with him, and then his wife was left to look after him all by herself. But once they understood what the memory processes were, why he was making this mistake, that he wasn't doing this wasn't his personality, this wasn't his intention, they were able to develop an understanding, and they could visit and support them again at the same time protecting the granddaughters from anything untoward happening to them, and taking care of them, because both of them have to be looked after. So having that understanding of the processes can make an enormous difference. I've witnessed a couple of young women who felt absolute horror and absolute hurt because their dad was inviting them to bed and that kind of thing. But once they understood why, that horror and that hurt just melted away, and they were able to become fond of them again, and even able to joke with it. You know, one of the ladies used to say, it was so important to her. She wanted to always have her dad with her, and she never wanted to have him go into long-term care. And then this happened, and she didn't know what to do. So she was able to take that back again and say, okay, I can do this. And she'd say to him, "No, Dad, you're going to sleep by yourself tonight. You'll be fine." You know, she just dealt with it with a sense of humor, because it wasn't really her dad's intention, you know, to sexually abuse her, and she had to understood that. So the context of this unwanted sexual behavior is rooted in long-term memory loss. And this situation certainly pertains to nursing staff, nursing home staff as well. Because when they're giving intimate care, the person with the dementia doesn't know that they're in a nursing home. They don't understand that they're elderly. They don't understand that they can't do that care for themselves. To them, it feels as though this is someone who wants to have sexual intimacy with them. And so it's very important to understand what their point of view is, and to set up that intimate care so that doesn't happen. You know, I can't give you the correct formula for how do you do this every time. That depends on the individual. It depends on the individual home. But knowing where it comes from is very important. So the emotional changes that people experience, they still experience a full range of emotions, so joy, sorrow, anger, delight. What changes is that they can no longer inhibit the expression of those emotions. So without dementia, we can hide how we're feeling. We can be in a room with a big family group or lots of friends, and we can be feeling angry or bored or thinking something's funny, and we can not let anybody else know exactly how we're feeling. But that's doing two things at once. And so people who have dementia, the way they're feeling, what their first thought is going to get trotted right out there. And they're not able to control that, because as I said, it's doing two things at once. And they may also say hurtful things to people. So for example, they'll look at somebody and they'll think to themselves, "Oh, I hate the color of that coat. How can they wear that?" And we would say, "Oh, that looks so nice on you." And the person with dementia is going to say, "What on earth did you buy that for?" And so it's important to understand where these kinds of things come from, that they're not able to inhibit what they're feeling. They may also appear to be experiencing mood swings. So with the short-term memory loss, they may have had an argument with the person that they're living with, and then off they go, they forget about it. The person that doesn't have the dementia is still going to be feeling riled and upset, and yet here they come back into the room and they're all happy and easygoing, and it's just gone for them. And so it's really important. Using empathy, using distraction is important to help a person with dementia remain calm, especially if something happens that is upsetting them. They experience something or they think about something that's upsetting to them. The emotions that are paramount in dementia are fear and anxiety. So the most important, look at all the things that I've talked about already and imagine them happening to you. And so keeping the person calm, keeping anxiety and fear at bay, this is very important. These people are losing their roots, becoming unable to function, being treated differently. They become very anxious. And sometimes this anxiety can lead to what we call a catastrophic reaction, when people completely lose their temper and lose control of their actions. And I firmly believe that all of us are capable of catastrophic reactions if we're pushed hard enough. And an example of this the daughter of a fellow who had dementia was her father went out the back door and her mother didn't see him go. The police got a phone call and he was walking down the middle of the street. And, you know, this fellow was over 80, but he looked young. He had black hair. They thought he was in his 50s or 60s. He didn't understand even what a policeman was. So this stranger came up and tried to get him to come off the street, and he ended up fighting with the policeman. And so when she worked in the hospital, and when she came down to emergency where the police had brought her dad, there he was with a broken nose, covered with blood, and his hands were in handcuffs. And she went ballistic. And she said, you know, Jennifer, I never thought that I could ever be like that. But I couldn't stop yelling and screaming until they got those handcuffs off my dad. And so that's an example of, you know, a person with no dementia having a catastrophic reaction. And she was shocked by that. So the threshold for people with dementia is lower. It's easier for them to have a catastrophic reaction because they lose control of their calmness more easily. Their anxiety they're almost always in a constant state of anxiety, not knowing what's coming next and what they should be doing. Arguing can push a person into a very high state of anxiety. And you know, it's important to remember that arguing takes a short-term memory. We all have arguments with people now and then. You go back and forth and you give a little, you take a little, you present different aspects of the situation. But you have to remember what's being said for that argument to be resolved. So when somebody has a short-term memory loss, they end up right back at the beginning. And so it's really important to understand that there really isn't a lot of point in arguing with a person with dementia. People with dementia also experience delusions, illusions, and hallucinations. So a delusion is when you think something is true that's not true. These are fixed mistakes in judgment in their mind. So for example, because of short-term memory loss, people with dementia very frequently lose things. They don't remember where they put them down. And then they go to find them again and they're missing. Now, if you put something down somewhere and you can't find it, somebody else moved it. Somebody might have taken it, right? People with dementia are no different. They go, oh, somebody stole this on me, you know. They lose things all the time. They forget where they put things all the time. So people are always stealing my things. It becomes a procedural memory. When I put things down, they disappear. And so then it becomes people are stealing from me all the time. And it reinforces their procedural memory. So it's important to understand this kind of delusion that people are always stealing from them. We label that as they're paranoid, you know. And sometimes they even get medicated for that paranoia. This is a natural development in the progression of dementia, and it's very important to understand that it's a natural and a normal step. And so you find other ways to deal with it that aren't giving sedative medication, aren't continuous arguing with, no, nobody would steal your things here. Can I help you find it? And then off you go and try to distract them. And maybe you do even find it. That's good too. So continued arguing and complete unease often results from other people failing to understand the reality of the person with dementia and why that delusion makes sense within their reality. People also experience illusions. So this is when they see or experience something that's actually in the environment and it morphs. I love that word morph. It changes into something else. One fellow, for example, he was looking after his mom, and he had to take away all the patterned pillows and all the little knickknacks off the shelf, the little figurines, because for his mother, she would look at them and they became mobile little animals. You know, that's what she saw. That was her illusion. And she didn't want these things. She didn't want little animals on her couch and on her shelf. And to argue with her that those weren't little animals would have been absolutely pointless because she has no control over what she sees. And at that point in time, absolutely couldn't say to herself, well, I must not be seeing the right thing. He bought her a new bedspread. She wouldn't get into bed. And so for 3 days, she slept on the couch. And, she talked, but a lot of times she was muttering and not making a lot of sense. But he noticed after 3 days, he finally clued in on what the theme was of her mutterings. And the theme was all about snakes. And he thought about that for a little while, and he put it together with there were stripes on the bedspread. So he went into the room and he flipped it over to the plain side, and that was the end of that problem. So understanding the kinds of illusions that people with dementia have and is a huge clue to understanding their behavior and to being able to help them, rather than just saying, oh, well, she's got dementia, she just decided not to go to bed anymore. It's important to delve deeply into these situations. People with dementia also experience hallucinations, and so I often explain these to people. Imagine it's like having a dream when you're wide awake. When we go to sleep and we have dreams, it's like making a movie in our heads. We create images, we create sounds, we create touch sensations, smells, everything. So imagine that the mechanism that lets you dream only when you're asleep is broken. And you're all of a sudden you're dreaming when you're wide awake. And I use this as an explanation to help families understand what a hallucination might be like for a person with dementia. So very often people will see people, they'll see animals, and I always caution families, if the person is not afraid with this hallucination, leave it alone, it's not a problem. But when they have fear, I don't know if any of you have ever been dreaming and the telephone rings. And in your dream, you're still sound asleep, but you're trying to get to that telephone. So dreams are susceptible to suggestion from the outside. Hallucinations are also suggestible from the outside. You can make suggestions to people. There was one charming story that a personal support worker in long-term care told me about standing. She was looking at a lady who was standing over by the window, looking down at an empty parking lot, and she looked very troubled. So she went over and she said, "What's up?" "Oh, look at those little children. They're all lying on the ground. What's the matter with them? Are they sleeping or are they dead?" And this support worker really knew what she was doing. She says, "Oh, they're in the playground. Look, that one's in the sandbox, that one's on the swing." And the lady said, "Oh, aren't they having a lovely time?" So you can use suggestion in a way that just helps people reinterpret what it is that they're experiencing in a positive way. And a lot of families, families taught me that, actually. That wasn't something I figured out. I just listened to what they did when somebody was having a hallucination. We can't change their mind. We can't correct the fact that they're having delusions, illusions, and hallucinations. We can only help them cope with these changes. And oftentimes we see these changes, instead of looking at them as a natural development of the dementia, we see them as a symptom of anxiety, and then we medicate the anxiety, which of course then makes it harder for people to think because they have a psychoactive medication to deal with as well. I'm not saying never use psychoactive medications. Sometimes it's the only kind thing to do, but be very careful that it's actually needed, and reevaluate it very often. So it's important to work within the person's reality to help them achieve peace of mind. We have a lot of difficulty with people not accepting what we say is true. We all have a need to be right, and I'm sure you've all noticed this. Of course I'm right. And we want the person with dementia to understand that we're right. And this is something that's very hard for people to give up. Especially couples, they've been married for 55 years. And they've spent their whole marriage, I don't know, but this is my husband and I do this. No, it didn't happen that way. It happened this way, right? So this is a long-standing habit. And so having to give up the need to be right is something that people have to do consciously. And figure out that the person with dementia is not going to agree with you about what's true and what's not true, and not to make them upset by arguing. So you know, there was one lady whose husband's hallucinations used to really agitate her and as a caregiver, and she hated them. She hated the fact that her husband had hallucinations. But once she understood them, she went from being astonished and upset to one day, you know, he offered her an imaginary phone and said, "Would you like to talk to my dad?" And his dad had been gone for 20 years. And she said, I'll talk to him tomorrow. I'm really busy right now. So this is the difference between understanding and not understanding. You know, it's the stress that is decreased once people understand. It's still a very sad disease to have, but when people understand more, they have less stress when they're dealing with it. And actually, understanding hallucinations can certainly help people with dementia as well. We used to call it, as I said, your mind can play tricks on you sometimes. And there was one lady who came into the office with her daughters. And I said this to her, and I said, sometimes, you know, you see things or you hear things that aren't really there. Thank goodness, she said. I thought I was going crazy. I've been seeing angels and leprechauns all the time. And her daughters just looked at her because she was so embarrassed. She couldn't tell them. But for her to know that with her condition, that was normal, it was a very meaningful thing for her. So eventually, people with dementia don't know where they are in time or place. They don't recognize anyone. They also may be dealing with sensory misperceptions, with hallucinations, with an inability to interpret what their body is sensing, and also an inability to move their bodies in a coordinated way that they always have done. So this altered context, this altered reality, creates fear and anxiety and possible panic. And for me, this is the crux of dementia care, is to understand that these people always have an anxiety level and to always be watching for what you can do to help them feel secure. Because this panic can lead to catastrophic reactions. They can be triggered by other people driving the person to greater heights of agitation and fear. And so it's important to understand how your role with them is impacting them and why it's important to keep them calm and easygoing. And also, when you're not sure what to do, head for the thing that's going to be the most soothing for them. That's the best bet, if you can figure that out. But of course, the person can also be triggered into catastrophic reactions that have no relation at all to what other people who are with them are doing, by things that they're experiencing internally. I'm thinking of one fellow who, he hallucinated multiple copies of his wife. And so this happened especially when she was busy, you know, making a big dinner, flying around the kitchen, doing this and that. And he then would see 4 or 5 different wives, all identical, and each of them were talking to him. And of course, he was driven to distraction by this. I mean, he would get very, very anxious and very upset and start yelling. And the only thing that she could do was to go off quietly, turn off the stove, go off quietly into a room and wait for him to calm down, because there wasn't really anything that she could do. You know, at the height of a catastrophic reaction, anything you do practically is going to make them worse. It doesn't, you know, you try to soothe somebody, it's any input at all is going to have them blow. And so backing off and letting them calm down is the main thing, of course, is to try and prevent it from happening in the first place, but you can't always do that. And so trying to let them calm down on their own until they can relate to you again is better. It's really important to try to avoid labeling people as being difficult, because this changes how we view them, and it changes our body language, and it changes our approach. So it's important to try to alter their reality if possible to avoid the catastrophic reactions. But it's important to remember too, they're not going to remember that they had that reaction, but everybody else around them will. And so then when somebody else approaches them, they're going to maybe be frowning, maybe look afraid, distrusting, and that body language, they're going to react negatively to that negative body language of the staff or the people who are living with them. And this escalates the emotional level generally and increases the likelihood of another incident occurring. So even if you don't feel great about it, it's important to fake a smile. It's a funny thing about faking smiles. Have you ever tried it? They become genuine after a while. You know, they just do it, and then all of a sudden your mood lightens up. But you just do it in order to put them at ease. One example is a fellow in a nursing home. He wandered into somebody else's room. Now, that resident didn't have dementia and didn't like anybody coming into their room. And so this other resident started yelling and screaming at him to get out of the room. And the emotional level of that person was caught by the staff. And so they all came swarming in. Okay, here's a fellow who has always been able to go in any room he wants to because he owned the house. He paid the rent on the apartment. This is the first time that he's ever lived anywhere that he can't walk wherever he wants to go. And he doesn't even know that he's in a nursing home, and he doesn't know he's retired. All he knows is he's wandering around, just looking around and, you know, maybe shopping in a store, whatever was in his mind when he wandered into somebody else's room. All of a sudden, he's surrounded by people who are all frowning at him and who are all yelling at him, and some of them are trying to grab him. Now, put yourself in that situation. You would feel panic too. And so he had a catastrophic reaction, and he started pushing people away, and they had to call the police, and the police took him into the hospital, and he was sedated, and he was restrained. And after a few days, the family noticed, you know, hey, he's not drinking and he's not eating because he's so restrained and he's so over-sedated. Now, I'm convinced that if everybody else had stayed away and one staff member had gone into that room and said, hey, Sam, I've got something down the hall you're really going to want to see, that whole thing could have been avoided. And so it's really important to understand where he is and what he is experiencing in order to try to, and you know, if you have these kinds of things happening, it's important to sort of discuss them afterwards. What can we learn from this? What could we have done? This is not easy care. I mean, I might make it sound, you know, this is 20/20 hindsight, right? It's not easy care. And because you know what, you're never running into the same situation twice. And you know you're going to make mistakes, but it's very important to learn from them and talk to everybody. Talk about them together. So living with dementia, for the carer, it's accepting that there's a constant ongoing changing in the alternate reality of the person with dementia. It doesn't stay static, it changes as their situation deteriorates. And so they have a constellation of inabilities and of gaps in knowledge. And when there's a deterioration, it changes the whole picture of what they can do and how they understand the world and how you need to approach them. It's a little bit like a kaleidoscope, you know. I heard somebody say this many years ago, and I still think it's a good comparison. You have a kaleidoscope, and you just tweak it a little bit, and the whole picture changes. And that's how things go with the dementia. You know, there's a little deterioration, and all of a sudden, all the things that have been working to look after that person before are no longer working, and you have to stop and rethink them. And so, you know, you're negotiating the role changes with them. Now they can't do this anymore. Do they recognize that they can't do it? Do they care? Are you having to, you know, cajole them into it or smooth talk them into it? Or are you able to just take over? So, and also, the more the person with dementia loses, the more the caregiver's taking over. And so they're working harder and harder. It can be very difficult for the person to accept help. But it's also sometimes impossible for the caregiver to anticipate the changes that are going to happen. And then, you know, they can have things happen that they really feel badly about. There was one lady told me about her mom with dementia came up to her cottage. Everybody was spraying themselves, and they had their coats on because the mosquitoes were terrible. And her mom said, oh, I'm fine. You know, they're not biting me at all. So her mom needed help unbuttoning her blouse that night, and she was covered with mosquito bites. And her daughter felt terrible, and I said, you know, there is no way that you could have anticipated that your mother no longer knew what it felt like to be bitten by a mosquito. You can't anticipate that. And so you're constantly running to catch up, you know, and then the caregiver feels terribly guilty. And so they need that reassurance that, yes, they're doing a good job and they're trying their very best. So it's such a difficult, fine balance, because you're trying like anything to let them be as independent as they possibly can in order to avoid them becoming prematurely disabled. And so you have continuous adjustment and fine-tuning going on and taking place, and failure. And then, you know, I liken it sometimes to surfing. You're surfing along, everything's going fine, fall off the board, you get back on and you try again, and then you fall off again, and then that's how it is for people. An approach might be no longer working, and you need to change the status quo of how you're looking at that. For the person who has dementia, it's getting used to coping with the changes in themselves and managing their forgetfulness. We often had education programs, and I'm sure they're available here in town as well, for people in the early stage of dementia. These are necessarily the people with insight, of course. The people without insight won't go anywhere near them. Mostly, somebody can invent a way to have a course for them. That'd be good too. It helps them to discuss the difficult emotions that they're feeling. And also, I found that they helped each other develop habits, develop procedures to give themselves resiliency. It was just wonderful to see a group of people with dementia all laughing at the same thing. You know, one day, they all discovered that, and this is a procedural memory. Every time they read the newspaper, they read the headline, looked interesting, read the article, couldn't remember it. Went back, read it again, read it again, read it again. And then they'd give up, and they'd go to the next headline that looked interesting. And they were all doing the same thing, and they roared. They thought it was very funny. So sometimes, you know, these classes can give people a lot of resiliency. I remember one lady, she taught everybody, you know, whenever they made a mistake in their memory, to say, oops, there I go again, you know. So it's very heartwarming to see that. Also, the early stage classes can provide ideas that will help people to remember important things. You know, they give each other little tricks. And when the caregivers are given the information, they can reinforce it. For example, one lady would put a laundry basket in the hallway if ever she put a laundry on, so that she wouldn't remember and leave it in the washing machine for a few days, or using a whiteboard. It's important to remember that all of these changes take place in a context of grieving. Grieving for the person with the disease and for what they're losing, grieving by the caregiver. I would encourage anybody who has a family member with dementia to read the books of Pauline Boss, both Ambiguous Loss and Loving a Person with Alzheimer's Disease, because she is so eloquent in describing how caregivers learn to live with the ambiguity of having the person present and not present at the same time. And I think nobody says it better. Interaction, it's very important to keep the person calm. I hope that all of you have found a copy of the handout that I brought, How to Interact with People with Dementia. That was actually where I started with this, and then I wrote a paper called Understanding the Dementia Experience to explain the brochure, and then later on wrote the book. So interaction, keeping the situation calm, using unconditional positive regard. And by that, we mean no correction and no scolding. How many of you like to be corrected? You're doing that wrong. You know, your back goes up. Who does she think she is telling me that I'm doing that wrong? So when you have dementia, you're almost always doing something wrong. And if you're constantly getting corrected and constantly getting scolded, your back is always up. So it's important to have a gentle approach, create a supportive way of life, and to lower the demands on the person as they lose their abilities, while at the same time maintaining affection, maintaining positive regard, and helping them feel secure and feel cherished as they go through this terminal illness. These are terminal illnesses. And I think it's very important to recognize. This is why I talk about emotional palliation. This is palliative care, but it's emotional palliative care. There's no real physical pain stemming from having dementia, unless they have some other condition as well. There is emotional pain for the person with the disease, their family, professional caregivers. And so this is why this atmosphere of emotional palliation is so important. It's important to stay relaxed and to give care in a way that a person with dementia can tolerate it. Once when I was in a nursing home, one of the staff said to me, you know, I just hate this. She said, I'm the only one that can shower this fellow. As soon as I bring the shower chair into the room, he starts to scream. He screams while we put him on the shower chair. He screams all the way down the hall on the shower chair, all the way through the shower, all the way back. Doesn't stop until we take the chair out of the room. And she said, what should I do? I said, stop showering him. You know, and that's not something that everybody wants to hear. When we keep people clean, we're doing it to keep their skin integrity. This fellow was reacting as though he was being tortured. That's not palliative care. That's not emotional palliative care. And so when somebody has a reaction like that, you know how they're experiencing it. It's terrifying for them. That's not how we look after people who are terminal, who are dying. And it's important to develop that understanding. And, you know, I've said this many times, and people say, oh, but the ministry says for compliance, you know, I'm saying fight. Fight back, that you're not putting somebody through this kind of experience, that there's another way to bathe them, and fight for their right to go through this terminal illness in a way that's calm for them. So there's no way that we can contract or bargain with a person with dementia to get them to behave. You need a short-term memory to make those kinds of bargains. And by the way, when people with Down syndrome, a large number of whom develop Alzheimer's disease, dementia, a lot of their care before they develop dementia is based on bargaining, and this is something that I've worked a fair amount with the workers for people with Down syndrome, helping them let go of that urge to bargain, because that's not something that a person with Downs and dementia can still do. It's very important to create an atmosphere of warmth, of caring, establish and maintain trust with every interaction that you do. So promoting an atmosphere of emotional palliation, which is calmness, being accepting, being empathetic, being warm, non-confrontational and humorous and laughing, and promoting a sense of security and well-being. Being affectionate, having fun, having compassion, and being relaxed and smiling. So I'd like to thank, that's me, I'm all tapped out. I'd like to thank Lee Stones from the Ontario Network for the Prevention of Elder Abuse for inviting me here. And I'd like to thank you for being a very attentive audience. And if anybody has any questions, I'd be happy to try to answer anything. There we go.